what we did is we looked at mental health problems in children. We looked at things like behavioral problems, most commonly ADHD, attention deficit hyperactivity disorder. We looked at addictions. We looked at depression and anxiety. We looked at suicide and suicide attempts. And we also looked at developmental disorders in children. What we found is when we looked at mental disorders, we found that over a 4-year period, 14% of children have a mental disorder. In addition, we also found that over their whole lifetime, 3% of children have a developmental disorder. So much higher than we thought. But what's even more striking is these are diagnosed disorders, so that those, if we counted everyone who had suffering from mental disorders, it would probably be higher. Well, what struck us is that these children are found in all corners of the province across all socioeconomic levels. But we did find that some children are more at risk. So we found, for example, that children who are living in poverty, those who are living with parents that have many parenting challenges, for example, a teen mom or being involved in child and family services, those children are more at risk. We also noted that in rural areas, our data suggests that perhaps those children are not accessing mental health services early enough. Children who have mental disorders have marked distress. But what we found in this study is that it also interferes a lot with their lives. So for example, children, when we look at that whole group, they're more likely to have problems in school, less likely to do well in school, less likely to graduate from high school, more likely to be accused of a crime, or more likely to be a victim of a crime. We also found that they, which makes sense, use more health services, and they're more involved with social services as well. So there are some things that we can do as a province to support children with mental disorders. So the first thing is to support their families at risk. We should also be providing more training, providing more knowledge and skills to people who are providing services for children. For example, schools and social services, the justice system. What our province also needs are more prevention programs, because some of these disorders can actually be prevented. We need more early intervention. And then, of course, for children who are suffering from these disorders, in all corners of the province, we need better services. And finally, the province has been working and developing a child and mental health strategy. It would be really important to continue that development and investment.